Right now at 5, major changes to COVID safety measures inside North Carolina schools. The Department of Health and Human Services updating its guidance for schools. Thank you for joining us tonight. I'm Fred Shropshire.
And I'm Vanessa Rufus. So here are the 3 biggest changes to know about tonight. The state no longer recommending individual contact tracing. And here's why. State leaders say that contact tracing is less important with widespread transmission, the large number of asymptomatic cases that we're seeing, and the expanded access to at-home tests. Another big change, students and staff exposed to COVID don't need to stay home as long as they don't have symptoms. And the state also changing its definition of what being up to date on COVID vaccines means. And so that now includes booster shots. One important note, while the state did update the toolkit today, it doesn't actually take effect until February 21st.
So the question on everyone's minds, what about masks?
Yeah, WCNC Charlotte's Chloe Leshner joining us live from Randolph Middle School in Southeast Charlotte to talk about that. So Chloe, is the state still recommending kids wear masks in school?
Hey, Fred and Vanessa. Earlier today, the governor hinted that there could be changes to the masking policies, but the new toolkit continues to follow CDC recommendations. That is masking in the classroom in communities where the percent positivity rate is 8 or higher. CMS, of course, follows the Mecklenburg County mask mandate, which we know could be dropping next week. The real-life science lesson is continuing to evolve as COVID metrics continue to drop.
And we want to make sure that you get a good education.
Governor Roy Cooper says more changes could be coming in the classroom.
We're going to have the Department of Health and Human Services a little later be issuing updated school toolkit to talk about that. And so I'm pleased and hopeful that we can get back to normal lives with the understanding that we're all going to need to do things to make sure we protect ourselves dependent upon the risk.
Earlier today, North Carolina Speaker of the House Tim Moore sent this letter to the governor asking him to end policies that would have students mask up in the classroom. And while it's being considered, doctors warn against moving too quickly.
So school settings are still higher risk because of low vaccination rates, as well as, fairly crowded conditions.
Dr. Charles Berger with Novant Health says he doesn't have a clear number in mind for when it's a good time to pull back mandates. The CDC recommends masking in areas with high community spread. Right now, that's 98% of the country, including the Carolinas and Mecklenburg County. The latest data shows 18.5% of the tests in the Charlotte area are coming back positive. Still, Health Director Dr. Raynard Washington says he could get rid of the mask mandate next week.
Certainly places that, keep a positivity rate in the 20s should consider mandatory masking, in my opinion. I think, when we get a positivity rate that's down below 10%, we're in a lot better place than we are right now.
I also spoke to a member of the White House COVID task force, and they say that the CDC guidelines remain their true north, which is why they still think that masking is appropriate in the classroom. And while there's a lot of enthusiasm around cases going down, cases still aren't low enough. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
Yes, a good point. Those levels are still high. Chloe, thank you.